Hi, I'm Dr. Charles Cobbs. I'm the director of the Ben and Catherine Ivy Center for Advanced Brain Tumor Treatment here in Seattle, Washington. What I wanted to talk to you about today is one of the special types of surgery that we do at an advanced brain tumor treatment center like the one we have here in Seattle, the Ivy Center. I often see patients who have malignant brain tumors or benign brain tumors for that matter who come to us having gone to another center first where a partial surgery was done and then they need a definitive surgery. And I wanted to discuss the reasons it's important to go to an advanced center for brain tumor treatment to get the right surgery the first time around. A lot of patients unfortunately don't have the option of doing that if they're admitted to the hospital under an emergency situation. But on the other side of the coin, a lot of patients do have quite a bit of time before they have surgery to look around, and I think it's extremely important for these patients to pick a center that can do the most advanced types of treatment. One of the things that I specialize in, because I feel it's the best way to take care of patients with tumors in certain areas of the brain, is something called awake brain mapping surgery. And let me just describe what that is. This is a model of the brain. And this is the left side of the brain where most people have their speech function. There's a part of the brain up here called Broca's area where the words are coming out. And there's a part of the brain back here called the Wernicke's area where we understand language. And then this area here is shown in green and purple is the sensory and motor area. Often I'll have patients like one I did this week where there's a tumor right in this area. So it's very tricky because you want to take as much of the tumor out as possible, but you certainly don't want to interfere with anything in this area, which is controlling the motor function and movement of the other side of the body, in this case the right side of the body. And you certainly don't want to hurt anything in this area, which is involved in interpretation of language. So what we will do is we will talk to these patients before the surgery, make sure they have a good enough speech function that we can test it during surgery, and we will give them a regional anesthesia or sedation so they're asleep. We'll put them in the position we need them for the surgery. We'll numb up the skin and actually do the opening of the surgery to expose an area about that big, as in the case I did last week. And then the patient is woken up and we start the surgery and we dissect down through the part of the brain we need to go to using computer-guided assistance. And then by doing this, we can often completely remove the tumor while the patient is talking to us and while they're moving the right side of their body to confirm that we haven't interfered with any of the function of the normal side of the body and the pathways that are going down from the motor strip. So, in summary, I wanted to emphasize that it's extremely important for patients to go to an advanced brain tumor treatment center where surgeons can use techniques like awake brain mapping to do the appropriate surgery to get all the tumor out in the first time around, since that makes all the difference sometimes in the end. Thank you very much.